what we know is that the significant majority of patients that we have seen in the hospital and being admitted with severe complications are adult patients above 18. The vast minority, less than 2% of the cases, represent pediatric cases. So for some reason, most likely genetic predisposition, kids are not getting sick at the same proportion that adults. The kids are transmitting the disease. They effectively can transmit it. They can acquire the disease. They are presenting usually a very mild respiratory picture of, is usually like a cold, a lot of congestion, rhinorrhea, discharge, watery eyes, mild fever, cough, but they are presenting in less proportion the significant disease of lack of oxygen or some more severe respiratory problems. However, once in a while, we see kids with severe COVID admitted to the hospital. So this is just to say that it looks like the kids are presenting a much more mild, less severe disease compared with adults, but the effectiveness transmitting the virus from kid to kids or to kids to the adults is there. They can effectively transmit it. Normally, a patient that acquired coronavirus, COVID-19, and it becomes symptomatic, usually the symptoms last for 1 week. We're talking about 7 to 10 days in average. There's a group of patients that will have some residual symptoms, some lingering symptoms of cough, some respiratory difficulties, and that can last for a couple more weeks. And there is a proportion of patients that is less significant, is less proportion, but still we are seeing it, is they ended up with post-infectious fatigue. They feel really fatigued, they cannot perform at the same level that before the COVID infection, and we're seeing that weeks following the COVID-19 infection. The good news is the vast majority of patients that have very mild disease, all the respiratory symptoms resolve by 1 week following infection. How vaccines work usually, the pathogen that is in question, it could be a bacteria or of a virus, it gets a particle of that infectious pathogen, and you design just with the particle or just with another protein. The intention is to induce an immunological response in the patient. That response could be with antibody-mediated response or through lymphocytes, and they just learn to respond to the pathogen, in this case the virus, and then develop a strong immunological response, preventing that we develop the symptoms of infection once we get exposed to the virus. So all the process of getting a vaccine studies, conceptualizing a vaccine, getting prepared for trials, recruiting in phase 1 trials when we see the vaccine is safe for use in patients, phase 2 studies where we see if the vaccines really work, and phase 3 when we see if it works in the large population. All that process, in addition of distribution, production, etc., that can take up to 7 years. So what we're seeing with the COVID-19, given the huge investment from governments, international collaborations, a lot of entrepreneurial, technological developments, and the huge investment from many countries in the vaccine production, that process has been like expedited and bypassed. We're now at the beginning of the phase 3 studies. Phase 3 is, remember, large populations getting to see the vaccines really works. There are in parallel many vaccines candidates for the COVID-19, But despite that big investment collaboration group, I think it's realistic to say that the promise for vaccine is not going to come before the summer of 2021. That's because we need to make sure it really works and we have the best product at the end of that line of production that's going to be safe for patients and effective to produce in large proportion and distribute across the whole society and across the whole world. So it's without doubt one of the largest investments in mankind in a vaccine production, but still it's going to take some time to see the final product.